Hey everyone, welcome back to all my listeners. This is episode 12 in season 18. Today is Wednesday, August 26th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Well, alright you guys, the month of August has simply zipped on by. I can't even believe we are approaching September in just a few days. That means Labor Day is coming up. That means the fall festivities are going to be upon us. I know I've been seeing commercials already for Halloween. What? I haven't even seen any fall leaves starting to change color, but definitely the TV is showing Halloween costumes and candy already, and it's just about the end of August. So a little bit shocking. I think I'm shocked every year, but yeah, I can't believe the month is almost over. So you guys know what today's episode is all about. It's the last one of the month, and of course it features my very favorite fraud, waste, and abuse cases for the month of August 2026. And I will definitely be spotlighting a few of the month's criminal and civil enforcement cases that I find newsworthy. And in my trusty tip, I'm going to focus on something that's brand new as of yesterday in some markets, and that is the AAPC's AI assistant, Codie. And in today's Spark, I'll go ahead and round out today's episode with a remarkable quote by Masuru Emoto. All right, you guys, let's get into it. So in today's Newsworthy, the month's fraud, waste, and abuse cases for August 2026. The month saw 29 cases as of the recording of this episode. So let's go ahead and check out some of those that I want to spotlight. August saw Medicare Advantage provider Complete Health to pay $14.1 million to settle False Claims Act suit. Complete Health Partners Holdings, which is headquartered in Jacksonville, Florida, has agreed to pay $14.1 million to resolve allegations that they violated the False Claims Act by causing the submission of false diagnosis codes in order to increase payments that they received from the Medicare Advantage program. Under the Medicare Advantage program, the MA program, also known as Medicare Part C, Medicare patients may opt out of traditional Medicare and enroll in private health plans offered by insurance companies known as Medicare Advantage Organizations, or MAOs. The Centers for Medicare and Medicaid Services, that's our CMS, pays these MAOs a fixed monthly amount for each Medicare patient enrolled in their plans. CMS adjusts these monthly payments to account for various, quote, risk factors that affect expected health expenditures for the patient. In general, CMS pays MAOs more for sicker patients expected to incur higher healthcare costs and less reimbursement for healthier patients expected to incur lower costs. To calculate the payment amounts, CMS uses a health-based risk adjustment model, or the hierarchical conditions of category, the HCC model, that takes into account diagnoses reported by healthcare providers. In general, the more severe the diagnosis or costly the associated treatment, the higher the risk score and the higher the corresponding payments to the MAO. Complete Health Partners Holdings, Complete Health, is a management services organization that manages, owns, or otherwise operates affiliated provider groups operating out of Florida, Alabama, and Colorado. Under the contracts, the MAOs agreed to pay Complete Health a percentage of the payments they received from CMS. This risk-adjusting compensation arrangement gave Complete Health a financial incentive to submit additional diagnosis codes to increase its patients' risk scores and the corresponding payments made by CMS. The settlement resolves allegations from 2020 to 2023. Complete Health submitted diagnosis codes within Hierarchical Condition Code, or HCC Code 55, for drug disorders that were not clinically valid, not properly supported by the patient's medical records, and or not considered in the care, the management, or the treatment of the patient. The United States contends that Complete Health disseminated incorrect coding guidance to its coders and physicians regarding diagnosis codes within HCC 55 and HCC 59. The United States further contends that Complete Health coders reviewed its patients' medical records and identified additional diagnosis codes for chronic conditions, including diagnoses within HCC 55 and HCC 59. Complete Health then prompted doctors to add those diagnosis codes even when the diagnosis codes were unsubstantiated or not clinically justified. As a result, the doctors added those diagnosis codes which were not accurate. These diagnoses resulted in an increase in payment from CMS to the MA plans in which the patients were enrolled. And the MA plan then passed along a portion of the increased payment to Complete Health. The civil settlement here resolves claims brought under the qui tam or whistleblower provisions of the False Claims Act. Under those provisions, a private party can file an action on behalf of the United States and receive a portion of any recovery. The whistleblower here will receive approximately $2.4 million as her share of the federal recovery. The claims resolved by the settlement here are allegations only, and there has been no determination of liability. August also saw a Nevada doctor charged with $95 million of wound care fraud on Medicare. A federal grand jury in the District of Nevada returned an indictment charging a 74-year-old MD of Henderson, Nevada, with a $95 million scheme to defraud Medicare by billing for medically unnecessary amniotic wound allografts that he and others applied to elderly Medicare patients. According to court documents, the medical doctor and sole owner of Dubin Medical Consultants, Inc., also known as Wound MD, caused Medicare to be billed over $95 million for expensive amniotic allografts that he procured through illegal kickbacks and bribes. He allegedly applied these allografts to elderly patients, including vulnerable patients in hospice care, without medical necessity. Medicare paid over $54 million based on his false and fraudulent claims. As alleged in the indictment, the doctor received illegal kickbacks, bribes, and rebates from two different allograft distributors. Some of these illegal payments were falsely structured to appear as legitimate, quote, rebate agreements, while concealing their true nature and illegal payments. These purported rebates substantially reduced the doctor's true net cost of acquiring the allografts. He allegedly submitted claims to Medicare seeking reimbursement for the price listed on sham full-price invoices instead of the actual price he paid for the allografts. The doctor and others allegedly kept as profit the difference between Medicare's reimbursement and the price paid for the allografts. The indictment also alleges that the man received illegal kickbacks from one allograft distributor through payments from a pass-through bank account held in the name of a shell company in exchange for purchasing allografts from the distributor. Induced by these illegal kickbacks, bribes, and rebates, the doctor and his co-conspirators applied allografts without regard to medical necessity, including by applying allografts to infected wounds, to wounds that were not responding to allograft treatment, without first attempting, completing, or confirming conservative wound care treatment as required by Medicare, and in quantities that far exceeded the size of the wounds. He allegedly selected allografts that would maximize his profit, not based on the patient's need. To conceal the lack of medical necessity, he falsified patient medical records to make it appear as though the application of allografts was medically reasonable and met Medicare requirements. He used the proceeds of his alleged offenses to fund a lavish lifestyle, including having multi-million-dollar yachts built for him. He is charged with conspiracy to commit healthcare fraud and 5 counts of healthcare fraud. If convicted, he faces a maximum penalty of 10 years in prison for each count. An indictment is merely an allegation. All defendants are presumed innocent until proven guilty beyond a reasonable doubt in a court of law. August also saw Veloxis Pharmaceuticals agreeing to pay over $46 million to resolve criminal and civil liability for kickback schemes. Veloxis Pharmaceuticals, Inc., a drug manufacturer based in Cary, North Carolina, has agreed to pay over $46 million to resolve criminal and civil allegations that it paid kickbacks to induce prescriptions and purchases of Envarsus XR, a kidney transplant immunosuppression drug. Veloxis has entered into a deferred prosecution agreement and will pay the largest Sunshine Act recovery in history. As part of the government's resolution with Veloxis, the company entered into a deferred prosecution agreement in connection with the criminal information in the District of Massachusetts, charging Veloxis with conspiracy to commit violations of the federal anti-kickback statute by paying for, among other things, lavish meals, alcohol, and luxury resort stays to induce healthcare providers to recommend or prescribe Envarsus. As part of the DPA, the Deferred Prosecution Agreement, Veloxis has agreed to pay a criminal penalty of more than $10 million. The resolution also includes a civil settlement of allegations that Veloxis caused the submission of false claims to the federal healthcare programs by paying kickbacks to hospital personnel and specialty pharmacies in violation of the False Claims Act. Veloxis has agreed to pay $34.45 million to the United States and certain states to resolve those civil allegations. In addition, Veloxis agreed to pay a $1.55 million civil penalty to the CMS to resolve allegations that Veloxis knowingly failed to report to CMS certain payments to physicians under the Open Payment Program, also known as the Sunshine Act. This is the largest Sunshine Act recovery since the law was passed in 2010. As part of the criminal resolution and the corporate integrity agreement with the U.S. Department of Health and Human Services Office of the Inspector General, Veloxis has agreed to implement a significant corporate compliance program, including adoption of an enhanced system of policies, procedures, and internal controls designed to deter and detect violations of the anti-kickback statute, and implementation of enhanced oversight, reporting, and enforcement mechanisms. The anti-kickback statute prohibits offering, paying, soliciting, or receiving remuneration to induce referrals of items or services covered by Medicare, Medicaid, and other federally funded healthcare programs. It seeks to ensure that medical providers' judgments are not compromised by improper financial incentives and are instead based on the best interests of their patients. Similarly, Congress created the Open Payments Program to provide greater transparency and protection to consumers by requiring drug manufacturers and others to publicly disclose certain payments and other transfers of value to physicians, with the goal of discouraging the development of inappropriate relationships and potentially unnecessary healthcare costs that can arise from such conflicts. Now, Veloxis's criminal liability for conspiring to pay kickbacks. According to admissions and court documents filed in the District of Massachusetts from October 2016 and continuing through in or around June of 2023, Veloxis and its employees engaged in a scheme to pay kickbacks to transplant healthcare providers, or HCPs, to induce them to prescribe, order, or recommend, or arrange for prescribing or ordering Envarsus for kidney transplant recipients. During the relevant time, Veloxis manufactured and sold a single drug, Envarsus, for use as an immunosuppressant in adult kidney transplant recipients. Envarsus, a drug taken once a day for the life of the kidney transplant recipient, competed against the generic form of the same drug, which was taken only once a day. To gain market share for Envarsus against a cheaper generic drug, Veloxis engaged in an aggressive marketing strategy pursuant to which it promoted Envarsus to HCPs at and tied to transplant centers and hospitals who could influence the placement of Envarsus on the formulary and or the protocol of their respective facilities. These marketing efforts included various tactics that violated the federal anti-kickback statute, including but not limited to taking HCPs and at times their spouses or guests to lavish dinners and on expensive trips and retreats under the guise of, quote, advisory boards, and providing gifts and expensive alcohol to HCPs and making purported consulting payments to HCPs for work that was not actually performed. In many of these instances, Veloxis employees submitted falsified company expense reports to conceal their illegal marketing efforts, including by falsely adding names to the list of attendees at dinners and events to decrease the apparent cost per attendee of the meals, and omitting the names of the physicians who attended the meals to avoid the Sunshine Act reporting requirements. This false reporting resulted in Veloxis's failure to properly report the sums it paid to physicians, which further obscured its illegal activities. Veloxis admitted that it intended the improper remuneration it provided to HCPs to result in increased Envarsus prescriptions, as demonstrated in part by communications between Veloxis employees and certain HCPs. For example, in connection with a surgeon's request to attend a speaker program, a Veloxis employee told the surgeon that the Veloxis employee, quote, needed scripts, lots of them, end quote. Several months earlier, the Veloxis employee had told the surgeon that he was, quote, over sales, end quote, and needed the surgeon to, quote, more than ever, end quote, and instructed the surgeon that it was, quote, time to open your Rolodex and make things happen, end quote. The statement of facts filed with the Deferred Prosecution Agreement details additional examples of Veloxis's kickbacks and related efforts to disguise and conceal its unlawful conduct. Moving on, Veloxis's civil liability for false claims to federal healthcare programs. The resolution also resolves allegations that Veloxis violated the False Claims Act by knowingly causing the submission of claims to Medicare, Medicaid, and TRICARE for Envarsus prescriptions written by HCPs or filled by pharmacies to which Veloxis had knowingly and willfully paid kickbacks in violation of the anti-kickback statute. In connection with the civil settlement agreement, Veloxis admitted that from 2016 through 2023, it paid kickbacks to HCPs in the form of lavish meals, alcoholic beverages, expensive trips, resort stays, gifts, and purported consulting fees to induce prescriptions of Envarsus. Veloxis admitted that it concealed those kickbacks by falsifying company expense reports and business records as to the recipients, amounts, and purpose of the payments, and creating consulting agreements for purported consulting work that was not actually performed. With respect to Veloxis's obligation to report physician payments under CMS's Open Payments Program, Veloxis admitted that because its reports to CMS were based on falsified expense reports, Veloxis underreported or failed to report the true amount of its payments or transfers of value to those physicians. In addition, Veloxis admitted that from 2017 through 2023, it paid kickbacks to specialty pharmacies in the form of per patient and per month payments to induce those pharmacies to begin or continue purchasing Envarsus instead of competitor drugs, including the cheaper generic drug. Veloxis admitted that it disguised the unlawful purpose of the kickback payments to the pharmacies by falsely describing the payments in written contracts as being for quote-unquote enhanced services, such as data collection or adherence services, when in fact, Veloxis admitted that it paid the pharmacies regardless of whether they provided any data, provided the specified data fields, or provided the data in the specified format, and without confirming whether any adherence services were provided. Under the civil settlement agreement, Veloxis will pay over $21.2 million to the United States to resolve the False Claims Act allegations and an additional $13.2 million to certain states for claims settled by certain state Medicaid programs. Veloxis also agreed to pay a civil penalty of over $1.5 million to resolve allegations that it knowingly failed to report the amounts of its payments to physicians under the CMS's Open Payments Program. In connection with the civil settlement, Veloxis entered into a 5-year Corporate Integrity Agreement, or CIA, with the HHS-OIG. The CIA requires, among other compliance provisions, that Veloxis implement a compliance program to identify and address the anti-kickback statute, risks associated with other financial arrangements, and retain an independent compliance expert to perform a review of the effectiveness of the compliance program. Veloxis received credit under the Department of Justice's guidelines for accounting for disclosure, cooperation, and remediation in False Claims Act cases. Among other things, Veloxis admitted liability and accepted responsibility for the misconduct, proactively disclosed inculpatory evidence not known to the government, and facilitated interviews with current and former employees and the collection of evidence from third parties. Veloxis also received credit for taking timely and remedial measures, including terminating employees responsible for the misconduct, updating and revising policies and procedures related to the anti-kickback statute, adopting enhanced training, reporting, compliance, disciplinary, and internal investigations programs, and terminating agreements and relationships with third parties involved in the offense conduct. The claims resolved in the settlement include certain claims that were brought under the qui tam or whistleblower provisions of the False Claims Act. August also saw Attorney General Raoul seeks to intervene in False Claims Act lawsuit against Chicago area medical practice and billing company over fraudulent Medicaid claims. Attorney General Kwame Raoul and the U.S. Department of Justice, the DOJ, filed a joint complaint in intervention alleging that the Foot and Ankle Healthcare Center Limited, European Foot and Ankle Surgical Care Limited, their owner, a doctor and billing company Atlantic Wave Holdings LLC, and Atlantic Wave 2 LLC, knowingly submitted fraudulent claims to Medicaid for podiatry services performed by the doctor using the names and national provider identifiers, or NPIs, of other physicians, despite his termination from the Illinois Medicaid program. In their complaint filed in the U.S. District Court in Chicago, Raoul and the DOJ alleged that the defendants carried out an unlawful billing scheme through their billing vendors, first Physician DS, PDS, and later Atlantic Wave. The defendants also failed to advise Medicare of the doctor's termination. These schemes resulted in more than $5 million in false claims paid by Medicare and Medicaid. Medicare later revoked the doctor's privileges effective September of 2022, after eventually learning of his Medicaid exclusion. According to the complaint, the Illinois Department of Healthcare and Family Services Office of Inspector General terminated the doctor's participation in the Medicaid program in May of 2019. To get around the termination and continue to bill Medicaid, the defendants allegedly directed billing personnel to submit his claims under other providers' NPI numbers, including podiatrists who did not render the services. Billing personnel allegedly used fake service locations inside their electronic medical records and billing systems to track which services were actually performed and by which physicians, while submitting claims to Medicaid and other insurers under other physicians' names. Defendants also allegedly billed for services performed by new physicians under established providers' NPI numbers to avoid credentialing costs. Raoul and the DOJ allege that Atlantic Wave leadership was repeatedly notified of the fraudulent billing practices after acquiring PDS in 2020, but continued processing and submitting claims that masked the identity of the rendering providers. The complaint asserts that Atlantic Wave executives were aware that this practice was illegal, but allowed it to continue, including schemes designed to avoid credentialing new physicians by billing under the NPI numbers of other doctors. On July 2nd of 2026, Raoul's office and the DOJ notified the court that they were intervening in a lawsuit originally filed under seal by Payer Health LLC, a successor billing company under the whistleblower provisions of the False Claims Act. After acquiring PDS, Payer Health learned of the fraudulent conduct, terminated the doctor's entities as clients, and notified the government. The complaint from Raoul and the DOJ seeks treble damages and civil penalties under the Federal False Claims Act, the Illinois False Claims Act, and common law claims for payment by mistake and unjust enrichment. The Federal and Illinois False Claims Act permit private individuals to sue for false claims on behalf of the government and to share in any recovery. The acts also allow the government to intervene or take over the lawsuit, as it has done in this case, and to recover 3 times its damages plus civil penalties. The public is reminded that civil allegations are accusations only, and there has been no determination of liability. And finally, August also saw another Medicare Advantage provider, Monogram Health, agreeing to pay $2.4 million to settle False Claims Act suit. Monogram Health Professional Services, PC, and Monogram Health, Inc., headquartered in Tennessee, have agreed to pay $2.4 million to resolve allegations that they violated the False Claims Act by causing the submission of false diagnosis codes in order to increase payments that they received from the Medicare Advantage program. Monogram provides in-home care and related services to Medicare patients enrolled in MA plans pursuant to contracts with certain MAOs. Under these contracts, Monogram was eligible to be paid more by the MAOs if the patients in its care had higher risk scores because the MAO received higher payments from CMS for those patients. These risk-sharing arrangements gave Monogram a financial incentive to submit additional diagnosis codes in order to increase its patients' risk scores and the corresponding payments made by CMS. The settlement resolves allegations that during the period from January 1st, 2021 through December 31st, 2023, Monogram knowingly submitted diagnosis codes within the following 4 HCCs that were not clinically accurate, not supported by documentation in the patient's medical records, and or did not require or affect patient care, treatment, or management. HCC number 21, which is for protein calorie malnutrition. HCC 55, which is for substance use disorder. HCC 48, which is for coagulation defects and other specified hematological disorders, and also HCC 88 for angina pectoris. The submission of these diagnosis codes resulted in false claims that inflated the risk scores of the Medicare Advantage patients, thereby causing CMS to make higher capitated payments to the MAOs than it would have paid without these diagnosis codes. The civil settlement here includes the resolution of claims brought under the qui tam or whistleblower provisions of the False Claims Act by a physician formerly employed by Monogram. Under those provisions, a private party can file an action on behalf of the United States and receive a portion of any recovery. The doctor will receive approximately $380,000 as his share of the recovery in this case. The claims resolved by the settlement here are allegations only, and there's been no determination of liability. And now it's time for my best practice tips in Trusty Tip. Did you know the AAPC has been rolling out its brand new AI coding assistant called Codie? Now, on August 25th, that was just yesterday, Codie was made generally available as an add-on for Codify by AAPC Pro Fee Coder subscribers. Now, medical coding continues to grow more complex, as my Paint the Medical Picture podcast tells us week after week, right? Medical coding continues to grow more complex as CPT, ICD-10-CM, HCPCS Level 2, payer policies, and documentation requirements evolve. Coders often consult several resources or seek input from senior staff before resolving an issue. Codie makes that process easier by offering AAPC-backed guidance available at any time, AI-assisted interpretation of complex coding scenarios, clear responses that flag documentation gaps for coder review, faster answers without searching multiple resources, greater alignment in coding decisions across teams. For healthcare organizations and revenue cycle teams, Codie helps senior coders spend less time answering routine questions and more time on higher level work. It also enables teams to reach well-supported conclusions grounded in AAPC guidance. Codie is designed to streamline workflows by acting as an on-demand medical coding expert. It answers routine coding questions, allowing senior coders and auditors to focus on complex cases. Now, what are some of the bells and whistles that the AI assistant Codie can perform? Well, Codie should be able to deliver answers that are grounded in official guidelines. Every response by Codie should include direct hyperlinks to relevant Codify search tools and official source materials. Now, Codie should also be able to provide contextual code search capabilities. So, Codie should be able to explain specific coding rules and distinctions between similar codes. It assists with code selection by pulling information directly from AAPC's database. Now, it can also help us with CCI edits and modifiers. Codie should be able to explain the correct coding initiative, or CCI, edit pairs. It provides guidance on when and how to apply modifiers to resolve unbundling issues. Codie can also help with local coverage determinations, those LCDs. It can help clarify the medical necessity criteria by interpreting those LCDs and national coverage determinations, those NCDs. So make sure you guys keep your eyes peeled and watch for the rollout on your Codify subscriptions soon. And finally, in this week's inspiring quote in Spark is from Masuru Emoto. If you feel lost, disappointed, hesitant, or weak, return to yourself, to who you are, here and now. And when you get there, you will discover yourself like a lotus flower in full bloom, even in a muddy pond, beautiful and strong. Wow, so very true, right? I love this quote on lotus flowers in bloom, the struggle, the resilience that we all go through, the beauty. We come out clean and pure despite the fact that we were growing all this time in mud. The visuals, I really, really loved this particular quote for so many reasons. And I do believe it inspires us in all the ways to see ourselves, our true and authentic selves, through all the noise, through all the distraction. We have overcome so much to succeed, to be at peace, to finally see what was there all along. I'm happy Masuru Emoto's spark still burns brightly and can inspire so very many. All right, you guys. Well, that wraps up today's episode. I really hope you guys got a lot out of those very few but very important cases that I wanted to showcase in the month's fraud, waste, and abuse cases that were made public on the OIG and DOJ websites throughout the month. So hope you guys got a lot out of that. Well, I know I'm looking forward to a new month of September. I know I'm going to be heading out to Las Vegas and talking to the American Medical Billing Association, AMBA, and their constituents. There should be around 350 people there. I will be speaking this year on winning appeals. I cannot wait to talk to my audience. I know I've talked about this over the years, and of course, over the years, the strategies change, right? And so I've got a lot of great pro tips for my audience when we get there. So I know I'm looking forward to that. And then all of fall is going to happen here in the Chicagoland area. I cannot wait for those temperatures to cool down, enjoy some respite from the heat, those few months of heat that we did have. But I love fall. It's my favorite season, so I know I'm anxious for it to get here as well. But anyways, you guys, I hope you all are looking forward to a brand new month as well. Can't wait to hear about it. All right, you guys, thank you so much for listening on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.